Okay. Well, good afternoon, everyone. This is Jody Dart, ACMHAI coordinator. Thanks for joining us for our webinar today regarding the Illinois AHEC Area Health Education Centers. So I'd like to introduce our two speakers. Our first speaker, Gloria Przygoda. She serves as the director of South Central Illinois AHEC with experience as a registered nurse in rural healthcare settings across multiple departments. She advanced her career as a family nurse practitioner, providing specialized care in the wound clinic at Pinckneyville Community Hospital. In her role with AHEC, Gloria facilitates AHEC student programs and educates her community. She conducts trainings for students and healthcare professionals, including BLS, ACLS, Safe Sitter, and she organizes trainings such as mental health first aid and Stop the Bleed. Our second speaker, Mary Jane Clark, is the director of the West Central Illinois AHEC located at Memorial Hospital in Carthage since 2019. Prior to this position, she was the Grant and Wellness Coordinator for the Illinois Critical Access Hospital Network. She has also served as the SOAR RN, which is Supporting, Onboarding, and Retention of Rural Nurses, coordinator for the ICAHN, it's a mouthful, Nurse Residency Program. Prior to her work at ICANN, is it ICANN? Is that how I refer to it? Okay, thank you. ICANN. She worked at Western Illinois University as a health resource specialist in the Illinois Institute for Rural Affairs and manager for the Mapping the Future of Your Community's Health Program, a strategic visioning and planning process to improve community health in rural areas. Mary Jane has over 25 years of experience working and collaborating to improve rural communities. And we thank you so much for joining us. Look forward to hearing how, all the work that you are doing and how our boards, might support those efforts in their own respective communities. And again, this is recorded live and we will archive it and send it out after the meeting. In preference in terms of questions, should we have them just post in the chat box?
That would work.
Okay, perfect. Well, with that, I will just hand it over. Thank you so much, ladies.
Thank you. Thank you, Jody. Yeah, and thank you guys for having us today. We appreciate it. Appreciate your time. So our presentation today is just kind of an overview of the AHEC program in general, and we will talk about some of the specific programs that we do. So the title today is From Classroom to Clinic, AHEC's Integrative Approach Through Programs, Resources, and Partnerships. So again, my name is Gloria Przygoda. I am a nurse practitioner here at Pinckneyville Hospital. I work in our wound clinic, and I also run the South Central program. And this is my amazing colleague, Mary Jane Clark. She works up at Carthage Hospital. She does so many great things up there, and she is over the West Central Illinois AHEC. We have 9 centers in general. So, oh, I think I was supposed to advance the slide there. There we are again. Okay, so by the end of this presentation, attendees will be able to describe the Illinois AHEC network and list available programs to help build the rural healthcare workforce, and also explain the benefits of collaborating with us.
Okay, I think I'm on. So we're happy to be here. A little bit about the AHEC network is we're here to really supply, distribute, and look at the quality of healthcare professionals throughout the state of Illinois. But AHEC is a national program. It's in 48 states throughout the country. It is not a new program. It was started in 1972 in order to help with the physician shortage. That's what it started as, but it has since moved to other disciplines because we see the value in building that healthcare workforce from other areas. So we're really here to promote health careers to students. We're looking at how we might enrich the learning environments, especially in those areas for rural and underserved. underserved communities where maybe they don't have access to an active STEM program or other things where they could get interested in health careers. And then we're providing professional development opportunities for professionals in the field. I work a lot on continuing education and things like that. So again, there's opportunities there for us to collaborate. We also work within our own respective regions on population health. So how can we make the population healthier? And if you have questions, you can either put them in the chat or you can feel free to ask those. I'm a pretty informal presenter, so if you think of something and want to ask it, certainly we can have a dialogue about those things. We are interested as we go through this presentation on learning more about what you all think about how we could collaborate. So I would encourage you to think about that, because there'll be some opportunities for that discussion as well.
So like I mentioned earlier, there are 9 centers throughout Illinois. As you see, Chicago's kind of divided into 2. And then the rest of us are all kind of dispersed. And so every region has at least one AHEC director. Well, one AHEC director, and some of them have an AHEC coordinator as well. It kind of depends. A lot of our centers are located in critical access hospitals, so your smaller rural hospitals, but some we have in universities. Mary Jane and I are both within a hospital. So it kind of just depends on the center, how it's set up.
So when we talk about education and training of the rural healthcare workforce, we may recommend ways to actually improve that. Getting students into organizations, letting them see what people do every day is critical part of what we do. Growing your own in your own community is invaluable. They're from your area, they know the resources, they know what is available. That is often very helpful for rural and underserved areas in reaching those populations. And so we work on things that help keep professionals in those areas too, because we don't want them getting burnout. We want them to have access to adequate education. And so there's opportunities for training for nursing, for other allied health professionals. There's opportunities for collaboration within rural community colleges. Having rural rotations figured into programs are things that we advocate for, because we know rural areas see different things, their values are different, how they look at opportunities for treatment, access to care is different. So all of those things are important when we talk about education and training of the rural healthcare workforce. Having residency programs, having fellowships, having those students in there to see what you do every day may actually impact what the students think. It could change their career trajectory. In fact, we had a nursing student that was in our facility that was planning on going to a bigger facility because she would have more opportunities in the emergency department to learn, and found out that she could learn just as much in a rural area because you don't have the specialties that just come in and take care of things. You have a team that you work with, but really you learn quite a bit more in those rural and underserved areas. So a lot of what we do is helping individuals figure that out.
So to dive into some more of the specific programs that we offer, along with the Grow Your Own, we do set up job shadowing for students, and we do work out in the community. It's not just within our hospital or within our host organization. We try to get students in the mental health facilities, in the counseling centers, in the health departments. So it's not just hospital focus, it's all of healthcare. We want the students to be exposed to all of the different options before deciding on careers. And we also go to health fairs at high schools, at colleges. Those are some of the grow your own type events that we go into. But this one here is one of my favorite programs. It's called a Rural Health Experience. It It's more for those students that don't really know what they want to do yet. It's not just for them. We also do it for pre-med students or other students that might, the overall goal of it is to get a overall picture of what healthcare is in a rural area. So we will take a student, they have to be college level. We don't accept high school students for this program, but they have to be college level, and they have to apply on the website, and then we will accept about every center accepts maybe up to 5-ish a year. And we'll pay for them to stay in that community and be fully immersed in that community. So we'll put them up in a hotel or an Airbnb, and then they will come to the hospital or wherever the AHEC director is located. Or we even have partner hospitals and organizations, and they will shadow multiple different providers or departments or healthcare organizations within those 3 to 5 days. So we set up a full schedule for them, and they'll even get to meet with administration. So it's literally just introducing that student to potential employers, potential colleagues. So it's really a great meeting. They attend, or a great program. They attend interdisciplinary meetings with other staff members, and it's really flexible. It's tailored to what the students' needs are and what their wants are. So if they're a pre-med student, we'll likely put that student with a lot of the different specialties or put them in surgery. So it's really it's a really neat program, and it's an experience that the students won't ever forget. And this is one that we're always looking for partners. We're always looking for new places to send students, to host the student. And depending on the center, we can help out with some of the cost too, as well, to be able to put that student up in their community. So that's just kind of an overview of that program. Make sure I hit all the little bullet points here. FQHCs, we send the students to FQHCs, health departments, community-based organizations, you name it. It's really, if the student has a preference, we try to meet that need and try to get them exposed to whatever their interests are.
And I have had MSW students that have participated in this and didn't necessarily realize what all they could do in rural areas. So that was a very interesting experience for that student.
And the cool thing is it's completely free for these students. So we have these programs out there that are federally funded that are available, and we just want to get the word out there because a lot of people don't know they exist. So I think we've been doing a really good job of getting out to the schools and bringing them flyers too, that like getting out to the people, like, we have these programs for you. And we're seeing an uptick in a lot of our participation in programs lately. So just kind of an overview. Oh, who does what? So the AHEC network will recruit the students for this program. We'll collaborate with the participating organization. We help plan out the schedule. If it's not us specifically that are hosting them, we will give out examples of previous schedules. We'll give out as many resources to the host site to make it as easy as possible. We cover the cost of housing and meals if we're able to. A lot of, I know my center does, I think Mary Jane's center does. And then the participating partners, for example, I'll have other hospitals sometimes host rural health experience students. So they will work with us to create a schedule and coordinate housing for the students and helping coordinate the meals. Usually we just give them cafeteria certificates for meals. So this is another one of our programs, and I'll let Mary Jane talk about this one.
So we also offer a 6-week rural interprofessional preceptorship program, which is a mouthful to say, apparently. And so this is a full immersion experience, and it runs, either May to June or June till July, depending on when they can coordinate that every summer. There is an application process and deadline for that. There's usually a waiting list for students to be able to participate in these types of events because the space for these programs are very limited. And so spaces fill up very quickly on this. So again, as we start promoting these things on our website, the AHEC network website, Students should apply quickly in order to be a part of this, but it's over a 15-day shadowing experience. They do classroom work. They do a community service learning project. So they learn how to gather data on a needs assessment and then how to move that forward. And like Sharon said in the chat, you know, she had students doing all kinds of things, going to Rotary meetings, going to other things. So I think it depends on the site and what all they get to do, but they get to work with an interdisciplinary team to learn all kinds of different things. Within that, they have to be a junior or senior in an undergraduate health major. They work together, so they try to put different disciplines together. So it won't be all pre-med students, but it may be a pre-med student, a nursing student, a social work student, you know, those kinds of things, so that it's a different experience, because everybody brings different ideas when you're talking about community needs. And so that's the value behind this. It looks great on a resume too, especially if they're applying to places who know what AHEC is and what they do, or if they're applying for med school or some additional schooling. This is great. It shows additional commitment on the part of the student. And so again, it just tells what the AHEC network does in terms of what the students get, and then what any participating partners provide. But we have a whole host of individuals that work on this project. And so, you know, if you would be interested in hosting this team to come to your facility, obviously that would be great. There's 2 locations in the state right now. They're hoping to increase that, but it's at Gibson City, and then another site is at Dixon. So again, those are the 2 places where it is offered, but it's a great experience. I had a pre-med student that was from my region that participated in this project, and then he was able to use that in his first year of medical school to participate in some projects. So definitely a value to the student, gets them into the community. If they can see something that they enjoy and they like and that resonates with them, it's a great recruitment tool as well.
I'm having a lag on my computer. Here we go. Okay, so the next program is just job shadowing. So we really encourage, when we go out to the high schools and present to those students, we always encourage them to job shadow, as that's the best way for them to learn about the career. So a lot of schools are starting to actually require job shadowing and before they can even get into the program, such as physical therapy, occupational therapy, medical doctor. So there's several of them. And like Mary Jane said, it always looks good on a resume. Even like these high school students, some of them haven't had a job, but if they have job shadowed, that's also a very good thing to put on a resume. So 16 or older, usually, just a lot of facilities have policies in place. Students have to be over 16 or 16 and older. But any high school students, undergraduate, graduate students, if anyone wants to job shadow, we can help get them set up with that. We can recruit students and send them to participating, not only hospitals, but any kind of health organization. Again, we can share schedules, planning timelines, press release documents. And if you have an organization that would accept job shadowers, we would definitely write that on our list of opportunities for students, because they're always looking for new places. And so if you would be open to allowing students to come in to your facilities, we would really appreciate that. And we can find the students to send to you, I'm sure.
And if students don't know what they want to do, we also have an opportunity for a virtual job shadowing platform. So if they want to get in and look at all the different things that industry offers, it's not just for healthcare, but there are other assessments in there: how to build a resume, how to build a cover letter, a lot of soft skills videos in there. It's really interactive, a lot of frequently asked questions for different disciplines. And so that can be important for that student who maybe doesn't know what they want to do when they get out of school.
Absolutely. So this is our AHEC Scholars Program. This is one of the biggest programs that we promote. It is for students who are already enrolled in a health professions program. And it's a 2-year program for students committed to improving health in rural or underserved communities. So they have to be enrolled in school for 2 years and be career ready or workforce ready at the end of their program. So we are looking for either freshmen in an associate's degree or a 2-year degree for freshmen, or if they're in a 4-year university, we're looking for juniors. So that way they have 2 years remaining of school.
And for behavioral health, it's MSW students that would qualify for this program.
Yeah, HRSA tells us kind of which disciplines apply. We wish we could take every health discipline, but unfortunately we can't. We do have other programs available for them if they don't qualify for scholars. So Scholars Program includes a mix of online learning covering our core topics, which we'll talk about, and it also includes a mix of community-based experiential learning activities. And at the end of the 2 years, they'll work with other AHEC scholars and other disciplines to come up with a community service learning project. We also do host a yearly summer institute, which we've had QPR presented in the past, and it went over really well for the students. They all got certificates from the training. And so that's kind of an overview of the program. So some of the benefits of the program: students get stipends or money towards professional development exams. This kind of varies based on the center and the budget in that center, but I think almost all of our centers do some sort of stipend for students. We do graduation cords and a nationally recognized certificate upon completion of the program. Professional development opportunities, they get a chance to watch a live virtual open heart surgery, and other monthly learning activities, which is so cool to watch. It's a really, really neat experience to watch.
And one of my scholars is actually presenting nationally.
Oh,
So
great.
she got selected. We just found out this week that she got selected to present with the national students for the National AHEC organization. So that's exciting.
So at the Yearly Scholars Institute, we have different speakers come in. It's over Zoom just to meet the students' needs. That way more of them can attend, but we've done QPR, seizure first aid, mental health first aid trainings. And then they get to network with other students. It's just a really great program for students to be involved in. Again, it's no cost to the student. Everything is absolutely free to them. Okay, so I'll let you go, Mary Jane. Sorry. It's kind of
No, you're fine. So the curriculum is set up so it's additional learning opportunities for the students, and we cover things like interprofessional practice transformation. Behavioral health is one of our core topics that we're always working on, which is great. Social determinants of health, because we know the impact that has on individuals and their healthcare needs. Cultural competency, or cultural sensitivity, more around that. Connecting communities to healthcare systems. We want to make sure that they understand the referral patterns and things in rural areas or underserved areas. A lot of virtual learning going on. So they learn about that. They learn about telehealth. And then we can talk about emerging health issues. So we have had some stuff on substance use disorders. HRSA pushes a lot of things about integrating opioid crisis and other things into our trainings. And so those are things that are very prevalent in our rural areas. And so those are some things that we do talk about. So if you have speakers, that's always exciting too for us.
We have used the Madison County coroner before. He was amazing, giving a really eye-opening presentation at our Scholars Institute on the opioid crisis and everything he sees from his perspective, and it was a really eye-opener for our students. So for the Scholars Program, again, this is what HRSA tells us who we can accept, but there's the list there. Like Mary Jane said, for the social work students, we accept the MSW students into this program. Was this one of your students, Sharon? Yes. So Sharon used to be an AHEC director, and she was amazing. And this was one of her students, Gerardo. The biggest thing for him was the exposure to other organizations and professionals through the volunteer experiences. He was able to put what he learned through the modules to use and gain real world experience in various settings. He's very thankful for being an AHEC scholar, and he recommends it to his other aspiring healthcare professionals.
Well,
So go ahead.
I was going to say, I work a lot on continuing education. Gloria and I both sit on the AHEC Northwest Center's Nurse Planning Committee. And so continuing education is important in our rural areas because of limited availability to get away for some providers, the ability to have access to best practices and those kinds of things. So we're always looking at how we can partner to provide continuing education. I know I work a lot with nursing, CHES, which is a certified health education specialist. I've been working on CME applications recently. That has been good. We do have some contacts that could probably provide some social work credits as we go through. So again, there's some opportunities there, I believe. We do have an MCHES, so if that would be something, Beth Squires is our MCHES from our Illinois AHEC network, so there's opportunities there. We can collaborate with hospitals, clinics, healthcare organizations to really promote opportunities that are available to them. We also have mental health first aid trainers. Sometimes AHEC is able to cover the cost of some of those seats. So it just kind of depends on the center and what is available. I've done stuff on advanced directives, had substance use disorder. We did a behavioral health series. Diabetes education is huge. We've done stuff on dementia. And then some of our centers offer CPR training and additional training within the organization. I have things that are skill-based. So we have mannequins, we have OB mannequins, and so we can do some education and skill-based training as well, depending on the center. We also have things that can be checked out, which I think we'll talk about a little bit later on, that can help with education as well. But we did sponsor, in my center, we sponsored for 2 counties, the Tim Ryan to come from Dope to Hope, a man in recovery, to come as a speaker. And so at the end of our grant periods, if we have additional funding that we need to use, we can prepay for some speakers and things like that, depending on the center and what's available. But part of that is building these collaborative discussions ahead of time and say, you know, what would be really great is if we could do this. And then we know that those things are of interest. And then when those opportunities arise, we have partnerships built where we can say, oh, wait, we have a HRSA grant that only AHECs can apply for, but we have these partners already. So we could go ahead and apply for this education and get individuals to the table to participate in it. Or we can get a quick memorandum of understanding because we've already built that partnership. So that, I think those things are important as we think about collaboration.
Yeah, my center last year, in addition, we had some extra funding available at the end too. So we got a speaker to come into 4 different high schools, and he presented 3 high schools, and he presented on vaping and the dangers of vaping and using drugs. And then he presented to grade schools on bullying and safe social media use. So he was really eye-opening. And yeah, so if we have the funding available, if there's any kind of education opportunity or need in your area, always ask us, because I mean, yes, the speaker's name on vaping was Robert with Dynamic Influence. And I can, while Mary Jane's speaking, I'll post his website so everyone can get to that. But he was amazing. The students, he did magic within his presentation, and it was just very engaging, and the students loved him.
So I've been doing a lot of work in the community health worker space. I have been teaching the Rural Health Coach program and the Professional Coach Advocate curriculum, which both of those things are available. So as we are trying to be a CHW 101 trainer, so we have trained most of our AHEC centers to be able to provide the rural health coach training and the professional coach advocate curriculum. And so we can then provide education in that way. And so that has been that's a starting point. We're waiting for the state to get the certification pieces in place. So we've been following that closely as we're looking at social service agencies. This would be a great opportunity for social service agencies that can then have community health workers who can get paid. So really, we've been following that a lot and working on what we are able to provide for those community health workers. If you're already using community health workers or patient navigators or peer network specialists or some of those kinds of things, they will probably move into that community health worker space to help with reimbursement. And so West Central Illinois AHEC is listed as a potential trainer for that. We've been involved in the environmental scan for community health workers, but we also can provide blood pressure certifications if needed. Mental health first aid is another thing that can be used for upskilling. Any of our continuing education opportunities that we have talked about, we believe will be then implemented at the state level. If it's offering nursing education, that it'll probably be approved for community health workers at the state. I also provide the professional coach advocate training along with some of our other sites, which after I'm a certified health and wellness coach, and after doing Well Coaches training, I think this is a really good brief overview of the coaching space and how it differs from counseling. And we're looking at moving people forward in that coaching space. We also do consumer wellness advocate training, which is CPR for wellness. So it helps talk about the different dimensions of wellness. I, again, am a lifestyle medicine nurse. And so if there's ways that I can partner for self-care, I've done presentations on some of those types of topics. Helping people learn how to take care of themselves on a different level. Sometimes in healthcare, we forget to put our own oxygen mask on first. And so I can do some presentations on that as well.
So grow your own with AHEC. So some of the things we do for the other programs that we do for high school students are summer camps. So we partner with several colleges all through the state of Illinois. We have now some in Northern, Central, and Southern. So I partner specifically with Southern Illinois University and Ren Lake College. And we are hopefully starting a new one with SWIC this year. But we offer summer camps for students, for high school students. These can look different based on funding in the colleges, but they could be a day-long camp, they could be a week-long camp. It just kind of varies based on the school, but those are always very well attended with huge wait list. Normally, SIU accepts 25 students and they had 50 on the wait list last year. So it's a very desired thing for students to be a part of. And the camps are always looking for speakers as well, and people to come in and teach the students about their careers and what they do. We do scrub exposure tours. This is where we invite students to come to the hospital and see firsthand, or not only the hospital, but other healthcare organizations. It's not just always hospital. But those are neat things too. We do classroom presentations, career planning, like Mary Jane said, the virtual job shadowing. I'm starting a dual credit course this year. We just had our first class yesterday where we students will it's like a career exploration where we're going to talk about different careers. So our job is to just teach them it's not just doctors and nurses. There are so many careers in the middle, and it takes a team, and really open up students' eyes to what all is out there for them. Some of the examples of some hands-on activities we do, we could do practice suturing with them. We have all the fun activities. We could do blood pressures with them. We have Jeopardy games. We have breakout boxes that can promote team building. We do those with employees too. It's like an escape room in a box. So those can be used by anyone too. If you guys ever have a need for those, we have them in both of our centers. They're really fun.
I have a middle school classroom checking them out this week for a fun Halloween thing with their kids. So
yeah. We have surgery simulators. We also have these new glasses here. They are virtual glasses that you put on, and students feel like they are in the career. So I put them on, and I do not like surgery, but I was in an operating room and handing the doctor supplies. And so I got to feel what a surgical tech would feel like. So without students having to go to the hospital, we have other options too that exposes them to the different careers. So those are some of the really fun things we get to do. But just know that we are out there.
And again, like she said, we are flexible in our program. There's some of us who love to build curriculum. I would be one of those that enjoy building new things. We also have lending libraries where we have different models that you can check out, heart, lungs, different things to show students. I have brain models and full skeletons and other things where we could talk about things for teachers or others to check out if they were doing it. Career exploration programs, again, at a lot of our centers, or we can get students connected if that's something that we need, and just building something that fits your needs. I've done anything from bloodborne pathogens with escape boxes to lab and chemistry type programs with students where they were in a classroom and the teacher sent me what they were covering, and then we can build those things. So I think it depends on the center and what they're comfortable with, but we all work together as a network. And so if one of us can't do it, it's possible that one of the rest of us could. So, and we work across center lines if we need to. And so that's the beauty of working within the AHEC network.
So we have a 5-year grant cycle right now. It runs from September of 2022 all the way till August of 2027. So some of the newer things we're focusing on is incorporating community health workers into healthcare organizations. We are working with Beth Squires in the program office in Rockford to come up with a public health youth group, which will also bring students together through the state. They will do projects and then potentially present those projects. So all kinds of new ideas coming, but we're always looking for fresh ideas that encourage students to choose a healthcare career, but that will also help drive your organization and grow your healthcare workforce as well. And like Mary Jane said, we're excited to establish new partnerships and in your region as well to connect students with your community opportunities. So again, as kind of a recap, we could use host sites for RHEs, and there's always opportunities for that, for job shadowing. We could promote behavioral healthcare workforce. We could work together with you and go to high schools and help present. There's all kinds of different ways that we can be here for you, and you could be here for us, all with the same goal. So,
and if you provide mental health first aid as part of what you do in your organization, if there's ways for us to promote those opportunities for you. Most of us have a social media presence as well. And so there's opportunities if you send us material that you would like to promote out within the region, we certainly can do that as well. I also participate with my local ROSC, so recovery oriented systems of care, just to have the partnerships in place in case if there's additional AHEC funding related to substance use and recovery. And so there's opportunities for us to participate as well. And this is my lovely CEO. She has been in healthcare for a really long time, and she absolutely loves students. And so she thinks that it is really beneficial for us to bridge regional partnerships. As she said in her quote, I'm not going to read this, but she says it's great. It keeps us fresh to have students. If we can explain why we're doing something with a patient, it certainly keeps our skills sharp. And sometimes we learn things from them that maybe is a best practice that they're bringing to us. And so it really is a way to make our organizations stronger, is to be able to partner throughout our regions in order to make the healthcare system better. She is one who will bring a room full of people together in our region. She brought them together related to behavioral health. We had 2 nurse practitioners and an licensed counselor at the time, and that has since grown to 4 nurse practitioners, 2 licensed counselors, MSW, and now a mobile unit going to the schools for rural health, because our rural health clinic can't go and provide services in the high school, but we can take a mobile van over there and do them in the mobile van. So sometimes rules don't make any sense, but sometimes there's workarounds. So if you're looking for ideas or best practices, or looking for a team to share ideas with, that is always a benefit of getting people together as well, because you hear what the ideas are. She was also instrumental in getting counselors from our mental health center into all of the schools, because that was a barrier, getting kids there from parents. And so again, she is very forward thinking, and AHEC is a part of that solution and building our workforce.
Sharon had a question. What do you do through the mobile van?
Well, I'll let you know next year. It's just being launched today.
Oh,
So,
wow.
we have a MSW who has joined our team, who is very passionate about young people. And he was recently trained, which AHEC funded for him to go to the youth mental health first aid instructor training. And so he is going out to build those networks with the schools and provide services for kids. And so that is just launching today. They were able to get a grant to pay for that mobile unit, and then they will be able to then provide services and bill through the rural health clinic. So that'll be great for being able to bill for those services to keep it going for sustainability of that project. So again, just launching today. So I'll let you know. Feel free to reach out later on, and I can always get you connected with Gavin. He's a fantastic resource for us. But we have a team that's really passionate about providing mental health services, as well as you all are.
Okay, I'm going to stop sharing.
Well, that was awesome, and that was very informative. I had no idea all of the services and that you offered and all of the opportunities for students to engage. I mean, obviously, workforce development is one of ACMHAI's priority issues, as well as our members that we represent. And before I throw it out to other questions, I'm curious, do you guys have like a flyer or something that would outline that we could share? Because as you know, our members are funders of those that do the services. Our members don't technically do direct services or provide direct services, but they do fund those organizations that do. Is there a flyer that we could share that they could then, let their
I'm trying to think which one, Mary Jane.
I would probably send the program flyer and the AHEC scholar flyer. That would be the two probably. We do have stuff that we've been working on to send out to high schools. That's so that they know what we offer for them. But if you're welcome to send this presentation out with the group and let them know. I mean, because it has all of our contact information on it. The website is on there. The website has a wealth of information. They've recently created an app for health career exploration. There are health career resource guides on there. So if somebody wanted to pull those off, there are career handouts, and they're from the Bureau of Labor and Statistics. So they can pull off what the median wage is in Illinois. They can, for that particular field. That
We've
those
also created booklets too. They're really nice career booklets, and social worker, that should all be in there as well too. So if we ever meet up, we can always share some of those with you guys.
Great.
And if we don't have it and it's something that fits within our goals, there's probably someone in our group that will create it, which is nice.
Yeah, that's wonderful. What a great resource. Any questions from any of our attendees here? Comments or? Hey, Lynn.
So I can, I still don't know how to unmute.
I'll just say it's
After all
great to
these-
see you both today.
Thank you.
That's great. Thank you. It's really
Great-
good
Great
information.
to see you today, and it makes me wish I were still working with the Illinois AHEC network. But I know that I can, so I'll be
Yes.
getting in touch with Rachel.
Yeah.
Good. Could
Yes,
I
and
ask
you
a
can
question
hear.
of your organization? What are some of your projects or goals that you guys are working on together as a group? If you don't mind me asking.
Well, this is part of, in the big picture, it's an important part of workforce recruitment and retention. And, and I've been hearing about these strategies at conferences, but it's nice to hear of one so close to home. So that's where it fits. I think mostly what we're doing in that space is advocacy, but I may be wrong. Our community funds a few workforce recruitment and retention initiatives, but nothing like this.
Well, we work
And to
directly
count- Oh, sorry.
with
I was just gonna say-
students. So if you ever want to develop a program or work with us, we're here. So sorry, Deanna, I didn't mean to.
No, I interrupted you, Gloria. I'm sorry. I was just going to say, so the Mental Health Board in DeKalb County, we do fund our AHEC scholars at the Northeastern group at NIU. So we had worked really closely with the prior person in that position, and Giselle ended up leaving. And so we need to reconnect with our new person who is very involved with our community, who has been a school board member. But we really are looking to just increase workforce that grow your own here in DeKalb County. So we have some pretty tight requirements around those scholarships. They have to be in our county and do work around behavioral health care. But it was really exciting to just learn more about what those opportunities are and to be able to connect on that local level. So I appreciate this today, but I also appreciate the bigger progress that is happening in Illinois with that.
Well, and if you are in a rural or underserved area, making sure that, students know about National Health Service loan quarter repayment or scholarships is really important as well, so that they know that it's okay. What we're finding with students these days is that they're really conscious about not having tons of student loans. And so they're worried about the financial piece if they do have to go on to get a master's degree in order to practice. And so we're seeing some of those things kind of deter students from going into those professions. And of course, we're working with a decreased population. And so we're all competing for the same individuals as other places where maybe they don't have to have those long degrees and things. And so I think it's going to be really critical for us to be passionate and out there telling them what our story and why we enjoy what we do every day, and the impact they can have on people's lives, because I think students are willing to give back. And I think that's a part of this next generation that's coming up, is what I've been told. And so we have to figure out ways to get them interested in something that may take them a while, but their options, those that grow your own, there's scholarships available. You know, we want them to know about those things. So if there's ways we can promote that, too, within our regions, I'm always happy to have those conversations and send stuff out if you have scholarship deadlines, you know, because we've seen a lot of scholarships go unfunded or to have nobody participating in them because we can't get students to apply. So we want to make sure that we are connecting with those students on various levels and can get it in the hands of the right person so that maybe they will fill those applications out as well.
I have a
That's another thing.
question.
Oh, go ahead. Yes.
I have a question about your cultural competency training. What tools do you all use? Do you all go by the Think Cultural Health with the national class standards, or do you create your own curriculum?
That is our program office. They have created that we use a platform called Teachable. So the cultural competence program is based on national standards. And so they don't use like a specific program that we would have to pay money for, but they have built things off of best practices from their work in public health and the field of medicine. So a lot of times those things are coming at it from, you know, a healthcare perspective instead of, you know, if that makes sense. So in terms of what as a physician or a nurse would need to do in order to think through how to be culturally sensitive when they're providing treatment, when they're doing care, when they're asking questions and those types of things. So I can't specifically answer which curriculum they use. I could get in there and look and see what they're using for that. But I know that they have pulled in other resources to do that, but they tend to use things that are have come from the AHEC organization too. And some of the ECHO programs. I know they've used some of those kinds of resources as well, where they've been treating an underserved population or someone in the midst of substance use disorder to help them think about how to meet people where they're at.
Yeah, Beth Squires, she's in charge of the Teachable platform, and she does a really good job of keeping the curriculum up to date. She just let us know a couple weeks ago that she just updated a few things. So she's really good. Yeah, but not for sure exactly which one she's teaching on.
Thank you.
Any other questions or comments? Well, thank you, ladies. It was great. Enjoyed learning about all the great things that you're doing. And if you wouldn't mind, if you could send us a copy of the PowerPoint, and I will share that with our members and make sure that they know to reach out to the contact information on the slide, and we'll go from there.
Thank you guys for having us.
Thank you. Thanks everyone.
Absolutely. Great to see you, Sharon.
Bye, everyone.
Bye.